This session covers the pharmacist's traditional dispensing role, the appointment-based model, medication therapy management, or MTM, and pharmacogenomic testing. Dispensing medications is still the primary income source for individual pharmacies. However, for prescriptions covered by insurance, which is the majority of prescriptions at a pharmacy, the majority of prescriptions are filled at a loss. The pharmacies lose money on the majority of their prescriptions. This graphic on this slide comes from a recent study from the state of Washington, where it shows how pharmacies were reimbursed by insurance for prescriptions relative to the pharmacy's acquisition cost of the drug. And you can see on here, if you really zoom in, 70% of the drugs, the pharmacy loses money, sometimes up to $100 for each prescription. Around 25% of the time, they make a little bit of money. And around 5% of the time, they make a lot of money. The pharmacies can't really control their reimbursement for these prescriptions or when those high reimbursement prescriptions are sent to their pharmacy. And so many are looking to offer other services to keep the business viable, such as over-the-counter products and clinical care. The appointment-based model is a foundational program for improving medication adherence and providing efficiencies for the pharmacy. The model is essentially combining medication synchronization with an appointment with the pharmacist. The appointment-based model is defined as pharmacist coordination of a patient's regimen in such a way that all the chronic medications are refilled on the same day of the month. Enrolled patients visit their pharmacist once monthly by appointment, or it could be every 90 days if all of their medications are 90-day fills, where the pharmacist conducts a short medication review with the patient, identifies any need for medication reconciliation, asks about over-the-counter treatments, and then answers any questions from the patient. This time can also be spent discussing other goals the patient may have, such as smoking cessation or routine vaccinations. You can see a full breakdown of the appointment-based model process in the graphic. The key differences between an appointment-based model and an autofill program are the preemptive outreach to the patient before the appointment date to update any changes to their medications. The pharmacy makes sure there are refills available from the prescriber before the appointment date, and the pharmacy meets with the patient on the appointment date to answer medication questions and discuss other health goals. The effect of an appointment-based model can be an increase in adherence of all the patient's medications by 20% or more, measured by proportion of days covered, or PDC, which is a common measure they use for quality measure programs. This increases the likelihood of a patient being adherent by 3 to 6 times, according to most quality measures. Medication therapy management is a range of services provided to individual patients to optimize their therapeutic outcomes and detect and prevent costly medication problems. This can include a review of all the medications prescribed by prescribers, providing care to the patient, and any over-the-counter or herbal products the patient may be taking, with the goal of identifying and addressing medication problems between all those different sources and prescribers. Problems may include medications not being used correctly, duplication of medications, unnecessary medications, or the need for medications for an untreated or inappropriately managed condition. MTM can also be an in-depth medication-related consultation to patients, family, or caregivers to help ensure the proper use of medications, or collaboration with the patient and the physician or other healthcare providers to develop and achieve the optimal goals for their medication therapy. MTM increases the likelihood that patients will receive beneficial drugs that can lead to fewer hospitalizations, and is particularly valuable for high-risk patients and disease states where the patient is taking multiple medications, such as a mental illness, or they have multiple chronic conditions. Identification of drug-related problems is one of the most significant contributions a pharmacist can make. Research conducted across Ontario showed that medication reviews conducted by pharmacists are able to reduce medication discrepancies and rectify drug-related problems. When 7 pharmacists in another Ontario study were integrated into 7 primary care practices and conducted medication reviews for 969 patients, the clinical pharmacists were able to identify at least one drug-related problem in just under 94% of the patients. And they also found an average of 4.4 drug-related problems per patient. CMS is planning to nearly triple the number of patients eligible for MTM in the Part D program starting January 2025 because of the solid evidence they've seen and the value they think the pharmacists bring to an MTM program. Some other subsets of MTM that you may see are medication reconciliations, where the patient's medications are reviewed to compare their list to all of the medications that the patient has been taking. And the goal is to avoid medication errors such as omissions or duplications, wrong doses, interactions. You can also have deprescribing campaigns fall under the term MTM, where the intention is specifically to find unnecessary medications. Precision medicine, also known as personalized medicine, is a rapidly evolving field that tailors medication treatment to the individual characteristics, needs, and preferences of that patient. This approach utilizes a combination of genetic, phenotypic, and clinical data to create a more precise diagnosis and treatment plan. With the dramatic expansion of big data and advanced analytics, precision medicine is potentially poised to revolutionize healthcare delivery, leading to improved patient outcomes and potentially significant cost savings. Pharmacogenomic testing, which is also known as pharmacogenetic testing, is one application of precision medicine directly utilized by pharmacists, though it's not yet mainstream. Here's a quick mental health case study that shows the value of reducing the need for trial and error. A patient is being treated for depression with a common SSRI like fluoxetine. The typical route is to try an SRI for 4 to 6 weeks, evaluate the impact of the symptoms. Despite taking the medication as prescribed, the patient continues to experience depressive symptoms. This could lead to an adjustment in dose, switching to another SSRI, or trying a different type of antidepressant for another 4 to 6 weeks. Sometimes it can take several adjustments and months of delay before the patient actually experiences a relief of their symptoms. To speed up this timeline, pharmacogenomics testing can be used to understand the patient's unique genetic profile and how it might impact the metabolism and effectiveness of the drug. The test may reveal that the patient has a variant of the CYP2D6 gene, an enzyme responsible for metabolizing drugs, including SSRIs. This genetic variation can cause the patient to metabolize fluoxetine more quickly than average, and that reduces the drug's effectiveness. Based on this information, the pharmacist can recommend a higher dose of the medication or to switch to another drug that is metabolized by a different enzyme. There are many straightforward examples like this, where pharmacists can combine the pharmacogenomics with their expertise in medications to optimize therapy for the individual patient. This session covered the pharmacist's traditional dispensing role, the appointment-based model, medication therapy management or MTM, and pharmacogenomic testing.